Hi everyone, I'm Donna Hamilton. Say Baltimore and what springs to mind? Crab cakes, Cal Ripken, Fort McHenry, but don't forget Mercy Medical Center. Mercy anchors Baltimore's downtown business district and is known for delivering academic hospital caliber care in a community setting. Investing in a Gallup study and dispatching a team to visit women's centers all across the country, Mercy has become one of the first hospitals in the United States to focus its mission on the care of women. As renowned breast cancer surgeon Dr. Neil B. Friedman likes to say, he is comfortable in his own skin. He is direct, to the point, and will drive around, over, or through any obstacle to solve the problem. Dr. Friedman led the charge to bring IORT, intraoperative radiotherapy, to Mercy, making it the first hospital in Maryland to offer this leading-edge technology. He's also a man of great empathy who embraces the 3 A's, availability, affability, and ability, in caring for every patient he treats. So 25 years in women's health for Mercy. That's huge.
Yeah, it
really is.
It's amazing that it's been that long. I just can't remember that it's been that long.
Right. And all the things that you guys have accomplished here in that time, when women's health wasn't really even truly much of a concept 25 years ago.
No, I think you're right. Most people didn't think about it. There was health care and it wasn't sort of specialized. There weren't centers of excellence.
Right.
So no, the world has changed a lot and we were ahead of a lot of the changes, which is nice.
And talk about changes. Think about the changes in breast cancer treatment and diagnosis. That is unbelievable.
It's huge. And you know, if you look at, you know, the mortality statistics, the mortality of breast cancer has gone down by 25% in the past several decades.
That I didn't know.
It's huge, with advances in imaging and picking cancers up much earlier, with advances in treatment. We're now using immunotherapy. All right, immunotherapy has been a dream for decades, and now it's part of our routine care for a lot of patients. But now we have patients where we give chemotherapy up front. We used to only give chemotherapy before surgery if the tumor was huge and we couldn't do surgery. And now, more and more and more, there are patients who are giving chemotherapy up front, shrinking the tumor, and then doing surgery. And in favorable tumors that are favorable in the sense that they respond to chemotherapy, about 60% we're finding that at the time of the surgery, there's no cancer left. So
that's amazing.
The next step is, gee, can we give some patients chemotherapy and do they not need surgery? Doing less, but still getting as good or better results.
Yeah, so you may be able to cure breast cancer one day, probably never just make it go away.
I mean, I think we are curing breast cancer. We're curing a lot of breast cancer. Even in the patients who are now considered incurable, who have metastatic breast cancer that's spread to other parts of the body.
Right.
And that, you know, if you get metastatic breast cancer in 80 and you can have a good quality of life to 90, that's huge.
That's really huge.
That's huge.
Amazing.
You know, the fact that we could stay and add technology all the time while still doing clinical trials. We're in multiple national clinical trials for drugs, for devices. And that's really something to be proud of at a small community hospital.
I mean, that's a vision that people have, to create that where it was not before.
No, I think you're right. I mean, it's, you know, I knew that I didn't, you know, academic medicine was not what I wanted to do. I didn't want to write papers all the time and have to do that and to get promotions and that sort of thing. I like taking care of patients. But here we can do both. We can do clinical trials that are cutting edge nationally, but still take care of patients on a day-to-day basis in a personal way in a small, very friendly community hospital.
You know, it's interesting to me, Dr. Friedman, is that a lot of times when a woman comes in for a breast problem, she may have 2, 3 buildings to go to, maybe have to move her car.
Yeah, and that's obviously difficult. Here, it's very easy. You know, as you can see here, our women's imaging center is right here, so mammograms, ultrasound. The breast center where I see patients is literally right over there, you know, 20 feet away, very close. And many patients come from out of town and will go get a mammogram and then walk over and see us. There's a connection in the back for the doctors to go back and talk.
Convenient.
Here's the breast center, right next door to women's imaging, literally 20 feet away.
Very close.
Very close. And then, you know, lots of patients have needs post-operatively.
Oh, absolutely.
Garment needs, or if you don't have reconstruction, you have breast prosthesis, bathing suits. And that's all right here in the Women's Health Boutique.
Any advice for women, for patients now, for potential patients in the future about their health care?
You've probably heard this before. Be your own advocate, all right? Sorry, don't believe everything you hear on TV. You know, TV brings on the latest story, the latest study, you know, the mammography controversy that was on TV a week ago, yet again, and will come back again and again. And those people entitled to their opinion, talk to your doctors, be your own advocate. If something doesn't seem right to you, ask your doctor, and if you're not getting the answer you think, go ask somebody else. I think that's the best advice that not just women, but anybody can have.
I would think for no matter what your specialty or field is when you're in the medical field, listening and really hearing the patient is probably so important.
It is. And you know, sometimes I'll look at patients and you know, you sort of see something going on behind the eyes and say, okay, you know, what's going on? Why did I not answer for you that you need? You know, that's a hard thing for patients. Breast cancer is a stepwise process now. You know, the old days, you had a lump, you went to the operating room, you went to sleep, you didn't know it was cancer until after the operation was done, you woke up, you didn't have your breast anymore.
Right.
Now, you know, it's a step, and then the next step, and then the next step, and it takes time, and that creates anxiety for patients. But I tell them, it's a stepwise decision so we can come to the best decisions for you.
Few in medicine today would argue the importance of women's health care, but that was not always the case. Mercy Medical Center was one of the first hospitals in the nation to recognize the need for a program dedicated to women's health. Armed with a vision, Mercy doctors and administrators joined with the Sisters of Mercy to create a center specifically designed for the diagnosis and treatment of women's disease, from breast and ovarian cancer to all manner of GYN conditions. Today, the Weinberg Center for Women's Health and Medicine at Mercy is recognized as among the best, providing quality care in a compassionate setting. I hope you've enjoyed this opportunity to become better acquainted with Mercy and its mission of caring, as seen in the physicians who have made this mission their own.